Hi, this is Sarah Poe. I'm the director at the Malheur County Health Department. Thank you so much for joining me for an update on the COVID-19 response in Malheur County and more information on the vaccine. We have a lot of reason to be hopeful right now. Our case counts are down. Our test positivity is down while vaccine administration is just going up. In the last month, we have seen our rates of cases go from about 300 cases per 100,000 people, so looking at that rate, down to just over 100. And so we're roughly about a third of the case rate that we had about a month ago. At the same time, the test positivity, meaning the percent of tests that are positive of all the COVID-19 tests that are done in our county, that's also gone down significantly and is remaining low. We're at about 3.5% right now, which means that there is sufficient testing happening and that we should feel pretty secure that we have a low risk of cases and transmission with enough testing that can continue. So we are not in the clear yet, but things are certainly improving from where they have been. Malheur County has been hit really hard by COVID-19. We had a lot of vulnerabilities that put us in a place where we were hit especially hard. And we've seen many of the populations that have been disproportionately affected by severe cases of COVID-19 in Malheur County. The CDC ranks this social vulnerability of all counties in the United States. And in Oregon, Malheur County actually had the highest social vulnerability index. And in some ways, we have some factors that are the highest in among the top 10% in the nation. And these include things like poverty, vehicle access, crowded housing, and chronic disease. And those vulnerabilities really made it so that COVID-19 hit us really hard when we already had many chronic stressors. So the vaccine is bringing a lot of hope and is also a key to bringing immunity to our community so that people's lives can be saved and that we can really get out of this pandemic. I'm thrilled to be able to introduce Dr. Sarah Laiosa, who is a public health physician and has been an important part of our COVID-19 response with the health department and our incident command system team. And so I'm going to turn it over to Dr. Laiosa to learn more about the vaccine, and just thrilled to be able to share this information with you. Thank you so much, Dr. Laiosa.
Thanks, Sarah. So like Sarah said, my name is Sarah Laiosa. I am a family physician. I live in Burns, Oregon. I have been helping Malheur County with our COVID response this last 6 months or so. And I wanted to talk to you guys about the vaccine. There's a lot of questions about the vaccine, so I've compiled some of the common questions about the vaccine, and I want to talk to you guys about those questions and concerns. The biggest question that I hear on a regular basis is how this got made so fast. We've been looking for vaccines for several things for several years. An HIV vaccine has been in the works for a very long time. And here we are, a little over a year into the pandemic, and we have 2 vaccines to market. A third is being evaluated by the FDA later this month. That's made by Johnson & Johnson. The vaccines that are already on the market are made by Moderna and Pfizer. In Malheur County, you guys actually have both of those kinds of vaccines at different places. And so the biggest question we get is, how did this happen so quickly? Like, this is really concerning to me. And I think that's very legitimate. It was very concerning to me too, not understanding how they were able to bring these vaccines to market so quickly. So I want to go through that a little bit. There's several reasons that they were able to bring these vaccines to market. The first is that COVID or SARS viruses are not new. There's been several that have come into the United States. In general, they make people really sick really quickly. And so they're easier to isolate than the COVID virus has been to isolate because they make people very sick very quickly. People die very quickly. They tend to self-isolate because they're not feeling well, as opposed to COVID, where a lot of people don't have symptoms or don't have major symptoms. So there's less isolation and they are not as sick. And so they're out and able to spread the virus. In other times, when other SARS viruses have come in, there has been a ramp up of concern of, thinking about how we would make a virus if we needed to, if any of these other infections were to get out of control. And so the first part is that we've kind of already been thinking about how to make a SARS vaccine when COVID happened. Some other things that happened in particular with COVID, is that $24 billion was put into the process of making a vaccine. And money certainly doesn't make everything better in science, but there are some things that it really does help with. Some of the other things that they were able to do with this vaccine is that they were able to get through a lot of the red tape at the FDA, which is who approves vaccines. They were able to, rather than once you make the vaccine sitting on someone's desk for a couple of years until it's viewed and the data is looked at, they were able to get that vaccine right at the top of the list. And so the FDA looked at the data as soon as it was available. One of the other things that happened with this particular vaccine is that they were able to test the vaccine and produce the vaccine at the same time. Typically, the process would go that you would create the vaccine, test it, compile all that data. It sits on someone's desk for a couple of years, and then they would look at that, approve it, and then you would produce it. With some extra funding from the government, they were able to test it and produce it at the same time, knowing that there was a chance that if it didn't test out well, that money would have been wasted. But the other chance was that we would have to wait, if it did test out well, a very long time for the vaccine to be produced. So if you paid attention to how quickly this happened, it went to the FDA on a Saturday, was approved that day, and actually started shipping via FedEx the next day on a Sunday, because they had already made it all. The other thing that is really important to think about with this vaccine is that it is not truly new technology. The mRNA vaccines, which is Pfizer and Moderna, we're not going to talk about how Johnson & Johnson works today, just because they haven't been approved yet. So we're gonna leave that one on the back burner for a little bit. These are both mRNA vaccines. There are lots of other therapeutics that we use in medicine that are done this way. There are cancer therapeutics that are done through mRNA inoculations, essentially. And so this science already existed. It wasn't something that we had to create from nowhere. That brings up an important point, that this is not a live virus. It is not a killed virus. So the way some other vaccines work is that we may take a little portion of a virus and inject it into people, not enough to make them sick, but enough to make their immune system respond. That is not how this one works. It's also not a killed virus. So sometimes we will take the vaccine, we'll kill it, but inject the dead cells, and that's enough for your body to make an immune system response. This is a totally different technology, but not a totally new technology. It's something that we're already using. So people were also really worried about that. Like, why did this, you can make it super fast and it's all brand new technology, but it's not really. It's something that we've already been using. There's a name for this in the cancer world. It's called immunotherapy. So if you've ever heard of that, had anyone, friends, loved ones on immunotherapy, that is what these vaccines are essentially the same as. One of the other questions I get a lot of is wondering about these vaccines in pregnancy and lactation. I haven't had a chance to talk to any of the OB providers specifically in Malheur County, but I have talked to quite a few of the other ones, as well as some NICU providers, about whether they feel like women who are pregnant, lactating, or thinking about becoming pregnant should get these vaccines. When you look at the American College of Obstetrics and Gynecology, they are the people who are in charge of taking care of our pregnant women. They say that the vaccine should not be withheld from pregnant or lactating women or people who are considering becoming pregnant. There is or was a concern posted by somebody who worked at Pfizer, and they said they actually stopped working for Pfizer long before these vaccines came out, and they said that they felt like the mRNA spike protein, which is what we're vaccinating people against, looks an awful lot like a placental protein, and maybe if we vaccinate people against this spike protein, they wouldn't be able to sustain a placenta. Pfizer took this very seriously. They researched it. It does not look like that is the case. When you look at the Pfizer studies, there were accidental pregnancies that happened in the treatment group. There was some miscarriages both in the treatment group and in the placebo group. So the people who got the vaccine and the people who did not get the vaccine had the same rate of miscarriages. So the current recommendation at this point is to offer it to pregnant and lactating women and people desiring pregnancy. Talking about the schedule a little bit, there are Two vaccines available in Malheur County, so it kind of depends on which one you got. If you got the Pfizer vaccine, you get your first shot, and then 21 days later, you get your second shot. If you got the Mrna vaccine, you get your first shot, and then 28 days later, you get your second shot. You should be getting a card when you get your vaccine, and on that card, it should tell you which brand of vaccine you got so that you can figure out when your second shot is due. And you should be getting your second shot from the same place that you got your first shot, with a few exceptions. If you've had to relocate or something in the process, we can definitely help you figure out where you can get your second shot. One of the big questions is, how long is this going to last? How often are we going to have to repeat this vaccine? And along with a lot of the other things that have happened in the coronavirus pandemic, the answer is, unfortunately, we don't really know. We know that immunity from a infection lasts at least 90 days, and that some people's antibodies tend to wane after that 90-day mark. We don't know about with vaccine. There are lots of incidences where vaccine is more effective than natural infection, and there are incidences where natural infection is more effective than vaccine. There is some literature saying that maybe vaccine immunity will last longer, up to 3 to 4 years, but we don't know for sure yet. Realize that the vaccine study participants are about 3 months ahead of the general public, which means that they got the vaccine about 3 months before it became available to the general public. So that's how far ahead the data is ahead of people getting vaccinated. So it is a living process, and we are learning as we go at this point. We want to talk about how effective the vaccines are. They're between 90 and 95% effective at preventing infection with the coronavirus. That's really great. That's way better than we can get with a natural infection. So those are really great numbers. And there's not very many vaccines that can boast that level of immunity. So that's phenomenal. Another question I get a lot of is, how long are we gonna have to wear masks after this? Like, once I'm vaccinated, can't I stop wearing a mask? And I wish that was the case. I'm ready to stop wearing masks everywhere, but there's this concern about people who don't have symptoms but still spread the virus. And that has been, this entire pandemic, a very concerning thing. And what we don't know yet is how much these people who have been vaccinated could not have symptoms but still spread the virus. And so at this point, there is no changes to the mask recommendations, whether you've been vaccinated or not. There's no changes to the social distancing recommendations, whether you've been vaccinated or not. However, some good news. The CDC is recommending some changes to quarantine if you've been vaccinated, which means that from 2 weeks after your second dose to 90 days, you will not have to quarantine for exposures. Obviously, there can always be some exceptions to this, but it appears that there's really low likelihood that people are going to transmit it with that 95% immunity. And so the quarantine period looks like it's going to be very different for those who have been vaccinated versus those who have not been vaccinated. At this point, the CDC has only commented out to the 90 days mark. I think that as more vaccinated people approach that 90 days mark, we might get more data, and that might change. That's ever evolving as well, but that's what we have so far. The other thing that I really like to spend some time on is talking about morbidity versus mortality. And these are words that in medicine mean two very different things. There is a 3% mortality rate with coronavirus. That means that of all the people who get it, about 3% of people are going to die. That's really statistically not terrible. You know, taking a long drive might be riskier than that. There's a lot of things that are riskier than 3%. And so there's a lot of people who say, well, why would I take a vaccine that's 95% effective for something that's 97% of people are going to live through? And that's a really great question. And so we need to talk a little bit about morbidity. Morbidity is the people who get sick and get over it, but never get well. So there's a concept right now called long COVID, and I'm sure it will get a better name, but at this point it's called long COVID. Long COVID are the people who get COVID and generally actually do not get terribly sick from it, but end up having these symptoms for months. I mean, we're looking at, there are some people, we're now a year out, there are some people who a year later are still having COVID symptoms, even though they had a really mild course. So we're not talking about the people who spent days or weeks in the ICU, even ever went to the hospital. For a lot of these people, they never were even that sick. They didn't go to the hospital. A few of my patients wouldn't have even known they had it if they didn't have, say, a family member who had it, and so they got tested in that course of things. And they're now really sick. I have 2 people, young people, who are no longer able to work even, young professional people who, because of their symptoms, are unable to work. So that's one morbidity of COVID, is this sort of long COVID. There is no treatment for it. There is no prevention for it at this point, except for the vaccine. And we don't really know when these people are going to get better, what could make them better. There are definitely studies in process right now, but we don't really know that this is anything that we can treat. So those are the people who had really mild courses and are now sick long term. We also need to talk about the morbidity of the people in the ICU. So there's all sorts of things. There's chronic lung disease or chronic heart disease. People are losing toes and fingers because there's a vascular component to COVID, heart attacks associated with COVID, strokes associated with COVID. So these are people who were sick enough to be in the hospital, either with their initial COVID diagnosis or right thereafter when the blood vessel issues and all that came up, who have lasting consequences from COVID. We don't have those numbers. I think they're still in the process of figuring out how many people have those numbers. Then you have to sort of risk stratify how many people had strokes as a result, how many people had heart attacks as a result. But there's a lot of concern with the long-lasting impacts of people who have COVID. Yes, they lived. They were not in that 3% that died as a result of COVID, but they're significantly impacted, maybe to the point of not being able to work anymore. And this is still going on for them. And I think that that's really important, that we think about COVID morbidity as opposed to just COVID mortality. Then, so the logical question becomes, does vaccine prevent long COVID? The answer is it should. We think we will see that. It hasn't been around long enough for us to be sure about that, but it makes sense that if you never get it, you would never get long COVID. So, I think that the data is pending, but will pan out to be that you do not get long COVID if you are vaccinated. Those are the really big questions that I had going into the vaccine, that I have talked to a lot of people, that they have questions about the vaccine. Sarah, do you have any other logistical questions or highlights I missed that you think I should cover?
That was really helpful. I guess I want to ask you, were you vaccinated? And what about the people that are eligible in your life? Are you recommending that everybody be vaccinated?
Sure. So let's talk a little bit about who should get it, who should not get it. There's a lot of questions, and one of that brought up a really good point that I forgot about is the anaphylaxis question. And the anaphylaxis question becomes, when it first came out, there was these people who had these horrible reactions to the vaccine. Maybe we should stop vaccinating. What's wrong with this? All vaccines have what we call side effects and adverse reactions. So side effects are things that are generally supposed to happen with the vaccine, but maybe a little more exaggerated. So for instance, there is a small percentage of children who, when they get the chickenpox vaccine, actually break out with chickenpox because there's a little bit of chickenpox in the vaccine. Happens. I've seen it happen multiple times in my practice. They don't get very sick, but they do. They get chickenpox. That's a side effect. It's not a horrible thing. It's not a concern, but it does happen. When we talk about adverse reactions, this is not the only vaccine that causes anaphylaxis. Anaphylaxis is a known side effect, potential side effect of most vaccines. Because if you're allergic to anything in the vaccine, whether you know it or not, you could have a major allergic reaction, which is what anaphylaxis is. So, we watched cautiously as, a couple people in the UK had reactions, and I think we had one in Washington or Alaska. There was one in Oregon, and we've been really careful with this. But when you look at those numbers, gosh, the last time I saw it, it's been a few weeks since I saw it, it was less than 0.5%. So 0.5% of people have a severe vaccine reaction to this vaccine. And that's actually really great. That's way less than we normally would have. When we talk about vaccine reactions in general, most vaccine reactions historically have happened in the first 6 weeks, usually much sooner than that. We're much more than 6 weeks out, both on the studies and now in the general population, and we're not seeing major adverse events. So you asked if I got vaccinated, and the reason why that prompted me is I actually have a anaphylaxis reaction historically to vaccines. I was absolutely vaccinated because I work in a health department, and I have a private practice, and I work in the ER, and I work around babies. And so to me, it was absolutely worth it. I did it with my public health nurses standing there next to me. They were probably a little more nervous than I was, and I had no issues. Now let's talk about the second vaccine and what is normal. So there is a normal reaction to the second vaccine that is supposed to happen. It is a sign that your immune system is working. So if you feel fatigued, if you have headaches, if you have a little bit of a fever, if you just feel bad body aches, that's supposed to happen. That is a sign that your immune system is doing exactly what it is supposed to do. Obviously, anaphylaxis is not supposed to happen. There are some things that are not supposed to happen. If you have concerns, if you have questions, you can always reach out either to the team that vaccinated you or your primary care physician. If you're wondering, hey, is this normal? Should this not be happening? 30% of people are having a pretty good reaction to that second vaccine. And to the extent where some people cannot go to work the next day because they're feeling that terrible. But that is what is supposed to happen. So I think we need to keep in mind that you're supposed to have a response to the second vaccine. You're supposed to have a response to the first vaccine too, but the second vaccine seems to be more intense, except for in people who've already had COVID, and then sometimes the first vaccine sort of has a second vaccine response to it. Your question was, am I vaccinating people in my life? So I have two grandmothers who live here in Harney County. They're in their late 80s, early 90s. They're both vaccinated at this point based on age criteria. My mom is a hospice social worker. She's also vaccinated. My grandmother's caretakers are both vaccinated. So yes, absolutely everyone in my life that I think meets the criteria, or not that I think meets criteria, that does meet the criteria, I have recommended to be vaccinated. So I think it's really important. I actually looked around to see if I could figure out how to get my kids enrolled in a vaccine trial. And they're actually really hard to find from here. There was one in Idaho, but you had to be within 100 miles. I can't remember exactly. And obviously I'm not within 100 miles. So the vaccine trials right now are happening in kids. Remember that Pfizer and Moderna both studied 18 and over. Pfizer was able actually to get their vaccine approved down to 16 based on the fact that 16 to 18-year-olds are probably just about the same. The studies right now are going to 12 to 17. We expect those studies hopefully out in the fall. That'll tell us if we can vaccinate that age range. And then they may or may not go lower. It really is up to the vaccine companies at that point what they'll do. They often go then from like 6 to 12, and then they'll go under 6 and do those studies. So I haven't heard a comment, and maybe Sarah, you know, different, a comment on Pfizer or Moderna if they're what their ages they're going to study this in. But yeah, I absolutely recommend the vaccine for everyone. Even I feel like if you have a history of any sort of concern, you can definitely talk to your primary care provider, see if they think that you should have the vaccine. As a primary care provider, I will tell you, I have two people who I said should not get vaccine out of, I have no idea how many thousands of people I take care of. And those two people are very unique circumstances that is appropriate to not take the vaccine. The published reasons to not take the vaccine is history of an allergic reaction to this vaccine or to one of the components of this vaccine. So if anybody took the first one and did have a severe allergic reaction, they should not have the second one. Or if they have a known allergy to anything in the vaccine. The great things about these vaccines is there's actually no preservatives in them. That's why they have to be stored so cold and so and used up so quickly. One of the things that the public may notice is that the logistics seem a little bit weird, and there's a couple of reasons for that. The Pfizer vaccine, which is mostly stored at hospitals, has to be stored at -80 degrees. Those freezers do not come easily. You can't just buy them on Amazon. and they have to be shipped and stored in all these weird containers. So for the most part, that Pfizer vaccine ended up at hospitals who had the freezers who could store that. The Moderna vaccine can be stored in a standard vaccination freezer, so it can be a little bit warmer. And then the Pfizer vaccine comes in 5 doses per vial. The Moderna vaccine comes in 10 doses per vial, but sometimes you can get one more out of each vial. And so we sort of have to group people to vaccinate them, which is why we've been doing these big vaccine pods, making sure that we have enough people, because goodness sakes, if we open a vial, we want to make sure that every single dose out of that vial gets used. And so this is not something where you can just stop at the health department and get your vaccine like you might for a tetanus shot or something like that. Well, tetanus shots are stored single-use vials, 1 vial per person. That's easy. These, once they're on the counter, are only good for a matter of hours, and then you have to make sure you have enough people to vaccinate. So you will notice, and Sarah has been running these vaccine pods, that we try to group people together and do it in big amounts of numbers at the same time, so that we can make sure that we get all the vaccine thawed, get all the vaccine ready, and get all the vaccine given, as opposed to just a little here and a little there.
Thank you so much. That's really helpful. I also wanted to mention that we have 2 websites that people should be checking regularly. Our local one is malheurhealth.org, and that has all of our press releases and the latest information, including an events calendar. That events calendar is where we will post when we have the vaccine pods that are hosted by the health department. Those right now we are hoping to be able to run each Thursday, but we won't put it on the events calendar until we actually know that that allocation is coming. And so we're hoping to be able to plan out a little bit farther, but if you check that events calendar regularly, you can be able to find out when is the soonest that you could go to one of the mass vax pods that the county is putting on. There are other health providers in the community that are vaccinating, including Valley Family. We're very grateful for their partnership. The hospital has also been such a great partner. They do have the ultra cold storage for Pfizer and have had limited doses. So we're thrilled to hopefully be receiving more and more vaccine. We are asking for more, but like many counties, a lot of us have the capacity to be able to vaccinate more people than the vaccine that we're receiving. So hopefully that improves. The other website is covidvaccine.oregon.gov, and that's the Oregon Health Authority website that has really Oregon-specific information, including a lot of the information that Dr. Laiosa has covered, frequently asked questions, and information about the sequencing and who is eligible. So I hope that everybody will take this information and share it with others. Please bring your questions. You can submit them to us through the malheurhealth.org website. And if we get your questions, perhaps we should have Dr. Laiosa back more often to be able to answer those questions. We would love to do that. We want everyone to know, yeah, this vaccine it's free. That's an important piece. This is free.
That's very important.
It is safe. It is effective, and we want everyone to do this to protect themselves, to protect those that they love, and to help get our community back to as normal as possible. We want to be done with this pandemic too. So thank you so much, Dr. Laiosa, for your time. Is there anything else that you'd like to add?
I think that's everything, but we'd love to have your questions. Sarah and I can definitely do this again. If there's enough questions and enough interest, we'd be happy to get the word out.
Thank you so much, and everybody stay safe, avoid those big gatherings, keep wearing your masks, and get the vaccine when you're eligible. Thank you so much.